Okay. Okay, so I'm gonna go ahead and share my screen because I did do a short presentation, just like you said, to give an overview of the report. Okay, can everyone?
Yes.
See? Okay, perfect. Okay, so like I mentioned before, my name is Damiata. I am the Maternal Child Health Program Manager, as well as the Child Fatality Review Program Coordinator for Pinal County Public Health. This is just a snippet on the 28th annual report that just got published November 15th. And before we get into some of the numbers or the data, I just want to go over a little bit on what the goal is for the Arizona Child Fatality Review, or as most of us know it, the CFR team. So the goal is to reduce child deaths in Arizona by conducting a comprehensive review of all child deaths to determine what steps could be taken, if any, to prevent each death. So in 2020, we did see a total of 838 cases in Arizona. That was an increase from 2019. In 2019, we did see 777 deaths. The leading cause of death for 2020 were prematurity, congenital anomalies, motor vehicle crashes, poisoning, and firearm injuries. Prematurity was the most common cause of death in neonates, and that's infants less than 28 days old, while suffocation was a common cause of death among infants 28 days to less than a year of age. So the CFR team was established to review all possible factors surrounding a child's death. The intent of the program is to identify ways of reducing preventable fatalities. Legislation was passed in 1993, and in 1994, the review process and data collection began. So as of today, we do have 10 local teams in the state of Arizona that conduct initial reviews with oversight from the state team and 2 subcommittees. So the report provides a comprehensive review of fatalities occurring in Arizona among children less than 18 years of age. Descriptive statistics and trend analysis used to prevent summary information about cases, as well as leading causes under each manner of death by factors of age, gender, race, and ethnicity. And the demographic and prevention information in this report are used to help broadly inform public health initiatives and the community. So recommendations for prevention are decided upon both the state and local review team based upon the information that is collected when these cases are reviewed. And towards the end of the presentation, I'll just show a little bit of those recommendations that were in the report. So what does this, what does a local team look like? So in our CFR team, you may see someone that is part of the county attorney's office, your county health department, county medical examiner's office, DCS, domestic violence specialist, law enforcement, a parent, pediatrician or a family physician, psychiatrist, or a psychologist. So the way the CFR team is conducted, it's by 6 basic steps. What we do is we share, we question, and we clarify all case information. We discuss the investigation, discuss the delivery of service, identify risk factors, recommend system improvements, identify and take action to implement prevention recommendations. So here in Pinal County, we review our natural cases with one of our pediatricians, and then all the other cases are reviewed with our CFR team. So just to show the report highlight, I do want to point out that these numbers are for the state of Arizona. The state team is currently working on providing county-specific annual reports that should be published sometime early next year. once that report is published, I will share that with our local team. But if you have any specific inquiries, you can always email those to me, and I can forward these to the state team. So just to go over the report highlights, like I mentioned, there was 838 deaths in 2020 for the state of Arizona. 47% of those deaths were preventable. 48% of all deaths were infant deaths, so a child under the age of 1. The mortality rate we see here is 28.1 per 100,000. And then we saw for natural cases, we had a total of 57% accidents, 28% homicides. We saw 6% as well as suicides. And then for undetermined child deaths, we did have a 3%. And I'll go into what does it mean when we say that this death was undetermined? We'll get into that in a little bit. And then the leading causes, we saw, again, prematurity, congenital anomaly, motor vehicle crash, poisoning, firearms. Out of the 157 substance use-related deaths that we had, 57 of those were fentanyl poisoning. 86% of firearm deaths were boys. 73% of children who died of abuse, neglect were less than 5 years of age. And 100% of all suicide, occurred in an unsafe sleep environment. So by suicide is sudden, unexpected infant death. All right, and here on this table here, we see the leading causes of child death by age group. On the table here, we see what was the leading causes. From prematurity, congenital anomaly, cardiovascular, other perinatal conditions, other medical conditions, and so on, depending on the age group. And if you, so this report, like I mentioned, I just did a few snippets of what on the numbers just to kind of go over them with you. But if you want a more detailed a view of the report, I will put that the website on the chat, so that way you can look at the published report, because the report is about 123 pages long. Okay, so we're going to get into the manner of death. So for accidental deaths, there was 232 accidents. We saw a 31% increase from 2019. 100% of these accidental injuries, deaths were preventable. We saw 63% were male, 37% were female. Between the ages of 15 to 17, there was a 38%. And then 39% of accidental injury deaths involved substance abuse. For homicides, we saw 53 homicides cases in the state of Arizona. That was an 11% decrease from 2019. 100% of these cases were preventable. The number one cause we have here is firearm. The number two cause is blunt force trauma. Number three cause, other injury. Of the homicides, 77% were male, 23% were female. 47% of homicides occurred in children ages 15 to 17, and 53% of homicides involved substance abuse. And then we move on to natural death. There was 475 natural deaths in 2020. That was an increase of 3% from 2019. 7% of the natural deaths that were reviewed in Arizona were preventable. The number one cause we see here is prematurity. Number two cause is congenital anomaly. And number three is other perinatal condition. Of the natural deaths, 54% were male, 46% were female. And then 50% of all natural deaths occurred in neonates. So again, that's an infant that's less than 28 days. And 15% of natural deaths occurred in post-neonates. So an infant 20 days older, but less than a year of age. And then 4% of natural deaths involve substance abuse. For suicides, there were 49 suicides in 2020. That was an increase of 30% from 2019. 100% of suicides were preventable. And then those are your 3 leading causes, being strangulation, firearm injury, and poisoning. 71% were male, 29% were female. 65% of suicides occurred in children 15 to 17, and 20% of suicides involved substance abuse. So undetermined death. So an undetermined death is that the medical examiner is unable to decide whether the manner of death was natural, accident, homicide, or suicide. So we did have 29 undetermined deaths in the state of Arizona, 18% decrease from 2019. 79% of undetermined deaths were preventable. We saw 72% were male, 28% were female. 48 of undetermined deaths occurred in children ages 28 days to a year old, and 28% of undetermined deaths involved substance abuse. So now moving on to the main cause and contributing factors of death. We have abuse and neglect. So we did have 95 cases in Arizona. This was a 5% decrease in abuse and neglect death rate from 2019. 100% of these cases were preventable. 37% were male, 63% were female. 44% of abuse neglect deaths occurred in children less than a year of age, and 62% of abuse neglect deaths involved substance abuse. So just to share with you on table 15 and table 16, so the leading cause of death we see here is prematurity at 16%. And then for the leading risk factor, we have at 66% CPS history with family. All right, and then we move on to COVID-19 related deaths, direct and indirect. So when they mean direct is if the case was determined where where the child was diagnosed with COVID-19 at autopsy, or if the child was suspected to have COVID-19, or if the birthing parent contracted COVID-19 during pregnancy. And indirect is if, for example, a suicide when the child experienced isolation during virtual learning or delayed medical care due to concerns about contracting COVID-19. So indirect deaths may occur anytime the child or family experience changes or disruption in how they lived, worked, or assessed services. So if you want more information regarding how the reporting went for the COVID-19 related deaths, the website is on there. I can add that to the chat as well at the end, so you guys can take a look at it. But there were 12 direct COVID-19 deaths in 2020. There was 29 indirect COVID-19 deaths. 7% of the direct COVID-19 deaths were preventable. 97% of indirect COVID-19 deaths were preventable. The number 1 cause being COVID-19 infection. Number 2 cause poisoning. Number 3, firearm injury. And then 58% of direct COVID-19 deaths occurred in children ages 0 to 11, and 79% of indirect COVID-19 deaths occurred in children ages 12 to 17. And then 8% of direct COVID-19 deaths involved substance abuse, and 45% of indirect COVID-19 deaths involved substance abuse. All right, and just to show you there on the chart for the number, for the leading cause of death, we saw poisoning at 28%. And then the risk factors for, we saw at 76% lives in an urban region. And again, in the report, if you want to see more detailed on regarding COVID, that does start on page 52 in the report. Okay, and then for drowning cases, there was 22 drowning deaths in 2020. We saw an 8% increase from 2019. 100% of these cases were preventable. Of the children who drowned, 68% were male and 32% were female. 95% of drowning deaths occurred in children ages 1 to 4. And then Hispanic and white children each comprise 41% of drowning deaths. And the number one risk factor for our drowning cases is lack of supervision at 100%. All right, and then firearm injury deaths. There was 51 firearm injury deaths, 41% increase from 2019. 100% of these cases were preventable. 85% were male, 14% were female. 70% of firearm injury deaths occurred in children ages 15 to 17, and 43% of firearm injury deaths involved substance abuse. All right, so to share tables 21 through 21, 23, 24, and 25. So the leading risk factor when it comes to these cases was 100% access to firearms. And then right below it at 96%, it shows there that the second leading risk factor was an unsecured firearm. And then the location of the firearm being at 71%, not stored. And for the firearm, it shows that 43% was used by the child. And then we see here for the firearm use, we have a 33% being crime and 31% being self-injury. All right, so motor vehicle crash death. We did see an increase on this as well, a 54% increase from 2019. So there was a total of 93 cases in the state of Arizona. 100% of these were preventable. 43% of these cases occurred in children ages 15 to 17. 58% were male, 42% were female, and 23% of these cases involved substance abuse. And we see here the leading risk factor is excess speed. And then right below it, we have lack of seat restraint at 34%. All right, premature death. There was 207 cases in 2020. That's including premature due to perinatal condition. That was a 13% increase from 2019. 8% of prematurity deaths were preventable. The number one cause being prematurity. 66% were male, 34% were female, and 7% of prematurity deaths involved substance abuse. And the leading risk factor for prematurity, we have poverty at 52%. And then at 34%, we have PROM, which is premature rupture of membranes. And then substance use related deaths, there was 157 cases. That is a 32% increase from 2019. 100% of these cases were preventable. And then the three leading causes, we have poisoning, firearm, and motor vehicle crash. 66% were male, 34% were female. 53% of substance use related deaths occurred in children ages 15 to 17. And of the 66 poisoning deaths, 60 were opiate overdose, and fentanyl was responsible for 57 of opiate poisonings. All right, so we have there the leading factors. As I mentioned before, poisoning at 42%, firearm injury at 14%, motor vehicle crash at 13%, prematurity at 10%, and suffocation at 6%. And the risk factors, we have prior history with CPS at 57%, and right below at 46%, we have parent history of substance abuse. All right, so sudden unexpected infant death. There was 53 SUID cases in 2020. There was a 30% decrease from 2019. 100% of SUID cases were preventable. 66% of these cases were male and 34 were female. 9% of the SUID cases occurred in neonates, and 91% of SUIDs occurred in post-neonates. And 50% of the SUID cases involved substance abuse. And the leading factor for SUID cases, we saw at 100% being unsafe sleep environment. And right below at 92%, objects in sleep environment. Alrighty, and just to share this table with you, it does give you an overview of the age group, and then it shows you in comparison where these cases were at from 2016 to 2020. All right, and just to move on to our recommendations. So when we meet as a team with our local team and our pediatrician, we go over on if this death was preventable and what recommendations can we put down to prevent these child fatalities from reoccurring. So this is just, again, just a little snippet of what's on the report. For prematurity, one of the things that they recommended was ensuring that pregnant women have access to quality and affordable prenatal care, in addition to expanding telemedicine services to women who are living in areas where they're not able to go to their OB appointment. For motor vehicle crashes, one of the recommendations that they gave was educating our children, parents, caregivers on the safe pedestrian practices and avoid distracted walking. They also recommended strengthening law enforcement capabilities to stop and cite vehicles with occupants that are not wearing a seatbelt by introducing a primary seatbelt law, because primary laws have been shown to result in higher seatbelt usage than secondary laws. For firearm injury, some of the preventive recommendations included removing the firearm from the household that had small children or adolescents. And gun owners should practice safe storage of their firearms, which require keeping the gun unloaded, locked, and in a safe with ammunition stored separately from the firearm, as this practice significantly reduces the risk of gun injury or death. For suicide, some of the prevention recommendations included increasing access to effective mental health care for Arizonans by adopting the zero suicide model statewide, implementing communication strategies using traditional and new media for school personnel that promotes suicide prevention, emotional well-being and mental health, and increasing public awareness of risk factors and warning signs. And some warning signs that they may see, like drug use, cutting, bullying, sexuality and gender identifying struggles, and then connecting people in crisis to care, including promotion of national suicide hotlines. And then for substance abuse, some of the recommendations that we're giving was expanding access to service for people with unstable housing and those that are experiencing homelessness because they are at a higher risk for substance abuse, improving access to personalized substance use disorder treatment plans for children and treatment plans based on individual strengths, because it can keep children engaged in their care and increase the likelihood of successful treatment and better health outcomes. And like I keep mentioning throughout the presentation, a more detailed list of preventive recommendations begin on page 82 on this report, because there is way more recommendations out there. And just reading this report, there's some where you look at these recommendations, you're like, wow, yeah, you know, this is really good. So I wish I could share them all with you, but is too much and too long. But I did leave the website there. Again, I'll put it on the chat. And I do want to give a very huge thank you to our Pinal County Child Fatality Review for all that they do. This is our updated list for 2020. If it weren't for them, we would not be able to capture all of this information. So from the bottom of my heart, I do want to thank our team for taking the time and helping us review all of these cases that come in. And of course, I want to give a huge thank you to all of you for all that you do in your community. And that's it for my presentation. Is there any questions or any comments?